Breathing difficulty or shortness of breath is a medical emergency. It is generally caused by an underlying medical illness such as asthma, allergic reaction, heart failure, or lung disease. At rest, normal breathing is regular and effortless. You may first suspect difficulty when there is a noticeable increase in the effort to breathe and the rate at which breaths are occurring. Coughing or unusual breathing sounds may occur.
Bill, what's wrong? Are you okay? Here, let me help. Come sit down.
A bluish-purple tissue color, especially in the lips or fingers, indicates a developing lack of oxygen and is a serious warning sign.
I think we should call for some help, okay?
Do not wait to see if a person's condition will improve. Activate EMS without delay.
Yes, I have a coworker here that's having a hard time catching his breath. Yes?
If an AED is available, have someone get it.
First aid kit and the AED, please.
Sure.
Allow the person to find the most comfortable position in which to breathe. Loosen any tight clothing. Breathing difficulty can quickly become life-threatening as a person becomes exhausted from the breathing effort. Be prepared to provide CPR and attach an AED if breathing stops. Reassess regularly until another provider or EMS take over.
Adam? Are you okay? I can help. Okay? Is it your asthma?
Asthma is a medical condition in which certain things can trigger a physical reaction in the lungs and make it difficult for a person to breathe. In an asthma attack, the small airway in the lungs become narrow due to swelling and the production of mucus. Airflow into and out of the lungs becomes restricted. Asthma triggers include allergens such as pollen and molds, irritants such as smoke, fumes, and dust, medications such as aspirin or acetaminophen, extreme weather conditions, exercise, stress.
Do you have an inhaler?
Quick relief medications delivered with an inhaler device work fast to help control asthma symptoms. If the person has a prescribed inhaler for asthma, assist her in using it. Remove the cap on the mouthport and shake the inhaler well. Have the person sit up with her head back slightly. Holding the inhaler upright, instruct her to breathe out all the way and then place the mouthport of the inhaler between her teeth, sealing her lips around it. While breathing in slowly and deeply, have her press down once on the inhaler canister to release the medication. Have her remove the inhaler and hold her breath for at least 5 to 10 seconds to help the medicine get deep into the lungs. Repeat as directed by the dosage instructions on the medicine canister. A spacer is a device that can help deliver medication more effectively. Use one if it is available. Monitor the person for any changes in his condition. Activate EMS immediately if the symptoms seem serious, get worse, or if there is no response to the medication within 5 minutes.
A severe allergic reaction, known as anaphylaxis, is an extreme response to the body's immune system to something it is sensitive to.
I got stung.
Common things that can initiate a severe reaction include bee stings, peanuts, latex, and penicillin. When anaphylaxis occurs, the airway can become constricted due to swelling of the throat, making it difficult to breathe. Wheezing may be heard. Swelling of the lips, eyelids, and face may occur. Itchy raised lumps or hives can appear on the face and chest. The person may complain of nausea and abdominal cramping. A severe allergic reaction can develop rapidly. In general, the faster the reaction occurs, the more severe it is. Without treatment, death can occur within minutes. Activate EMS. Allow the person to find the most comfortable position in which to breathe. A person with a history of allergic reactions may carry a prescribed epinephrine autoinjector. Epinephrine can quickly reverse the effects of the reaction and may be life-saving. Auto-injectors use a spring-loaded needle to rapidly administer a measured single dose of epinephrine. They are easy to use with minimal training. If the person has an auto-injector available, assist him in using it on himself. If the person has not responded to an initial dose of epinephrine and EMS is still at least 5 to 10 minutes away, a second dose may be given. Reassess regularly until another provider or EMS personnel take over.